Hey Brad, remember that song, All I Want for Christmas is My Tooth Front Teeth? Well, maybe you might want two white teeth or your front teeth to match and be straightened. Well, it's your turn to get some advice on that this morning. Dr. Mark Hyman is here to answer your questions about family and cosmetic dentistry. If you have a question for him, call 1-800-807-8255. Good to see you.
Good morning, Cindy.
Let's go to the phone lines because Sheila's on the line from Greensboro with a question. Good morning, Sheila.
Good morning. Excuse me. My question is about teeth whitening. I'm trying to figure out what's the safest way to whiten my teeth without harming my gums.
Right. Sheila, I appreciate you calling. Tooth whitening is the #1 requested procedure in dentistry today, and it is completely safe. Basically, it's a peroxide product, a hydrogen peroxide, carbamide peroxide, that oxygenates the enamel of your teeth. So you can get some whitening from some toothpaste. The best way in my mind is to do it in the office, whether it's with Crest white strips, you can do those at home, in the office with a custom fitted mouth guard that the dentist can make for you, or you can zoom your teeth, which is a power tooth whitening. So it really depends what's appropriate for you, how fast you want to get your teeth white. If you want a white Christmas and you've got a day to do it, you can go to your dentist and get them zoomed. But it is safe now. It's been done for over 20 some years, and I hope you can get that done.
Let's go to Melanie in High Point. Good morning, Melanie.
Good morning.
What's your question?
I have grand mal seizures, right? And my question is, can seizures have an effect on your teeth? And if so, how to prevent it?
Question about seizures affecting your teeth. The medication that you may be taking when people are younger and have those challenges of seizures, that can infect the enamel and dentin of the teeth. But as an adult, it really can't. The medication can cause the gums to overgrow as well. So the teeth themselves won't be impacted, but the health of your gums could be. So that's where hygiene has to be just immaculate, the brushing and flossing, and probably going to your dentist every 3 months to get your teeth cleaned, because you can't afford even a low level of infection, a low level of inflammation could cause bad problems.
Let's go to Teresa in Ruffin. Good morning, Teresa.
Hi.
Hey, Teresa.
What's your question?
Okay, I'm a tetracycline baby from the 60s, and my teeth were yellow, permanent teeth now, and I cannot get them bleached white. I've had the bleaching, and the bleaching is no avail to the stains, and I need to know what I can do to get them white.
So you've tried the whitening and that hasn't worked. Probably the next thing to do is talk to your dentist about what you could do cosmetically, short-term with some bonding, or really long-term to get some beautiful conservative porcelain veneers. Those are about the thickness of a thumbnail or fingernail and can be gently bonded onto the front teeth and can really give you a beautiful smile. What's important, I think, is symmetry as well when you speak to your dentist about how many to do. If you just do 2 or 4, it can not look natural. So most people, depending how big you smile, might want to consider either 8 to 10. But that can give you the smile that you really want.
And the tetracycline babies, the reason that they won't whiten is because it was done from the inside of the teeth.
While the teeth were developing,
yes,
they turn gray.
Yeah.
And that's a tough thing.
That's like if you have bonding already on your teeth, or you have veneers that are or a darker color, whitening processes won't work.
Whitening will not change old bonding.
Yes.
It won't change old porcelain.
Let's go to Angie in Greensboro. Good morning, Angie.
Yes, good morning.
What's
yes.
your question?
Oh, you want me to go ahead and start talking?
Sure, go ahead.
Oh, all right. Good morning. Yes, my question was about the blackness that that comes on your gums. People have told me that it's called something called pyorrhea, and I was wondering, is there any way you can stop the blackness? Like they said, stop smoking.
Your question is, you see the gums turning black from gum disease, from the pyorrhea as you describe it. That comes from not brushing and flossing effectively, and the calculus, the tartar, can build up on the teeth and it can look like it's black or dark. That won't brush off, it won't floss off at that point, so you just need to go see your dentist and have them professionally cleaned. It may take several visits if there's a lot of buildup, but you'll be amazed how fast you can feel healthier and look better and feel better.
All right. Thank you so much for
It's a
coming
joy
in.
to be here. Thanks for having
Good
me.
to see you.